I'm Dr. Lederman, and I'm here with
Robert Paderi.
And Robert, how did we get to know each other?
Well, I came down because I had been having a problem with my hip. It was due to arthritis, and it was causing me some severe tightness and some mild pain. When I would walk, say over 45 minutes, it would start bothering me, or it would bother me immediately if I started walking uphill or up steps. Something I had for about 7 years, so I could live with it, but it was very annoying. So I heard that recently, maybe about 6 months ago, you indicated, I heard on the radio that you were treating arthritic hips, so I figured I'd come down and give it a try.
Okay, so you actually had seen chiropractors and other doctors, right, before you came
Two
here?
chiropractors both said it was due to arthritis. They're based on range of motion.
And what did they do for you, and did they do anything useful or not useful?
They worked on my hip, and it helped for about a day and a half each
So
time.
it wasn't very useful.
It wasn't useful, no.
Had you tried medicines like anti-inflammatories?
No, I wouldn't take them.
So you're not really a big believer in medicines, right?
No, I am not.
And just to note, you're actually a vegan.
Correct.
You do
Yep.
everything you can to try to be healthy as you possibly can.
Absolutely.
And so what kind of things would you accept for the arthritis, and what kind of things would you not accept for your arthritis?
Well, certainly no drugs, and I certainly wouldn't do a hip replacement unless it was, I'd be walking in there on crutches if I had to do that.
So had you ever seen a surgeon about doing a hip replacement?
No.
Or had you ever seen a rheumatologist?
Nope,
So you weren't really interested in that kind of medicines or surgery, right?
that's correct.
And so what was so appealing when you heard about low-dose radiation for arthritis?
Well, I've been hearing you speak about treating cancer for many years, and what attracts me to it is, first of all, that it's low dose, and that it's specifically designed to kill the unhealthy cells and leave the healthy cells okay. I also had a friend who came to see you about 9 years ago. He had a prostate problem. They recommended that he have an operation on his prostate to have it removed, and he came to see you, and he said his PSA numbers came down to 0, and it's been 0 for about 8 years.
So you had a friend who was successfully treated for prostate cancer.
Correct.
And it's a good friend?
Yes,
So you trusted me to some degree because of him.
that's quite correct.
And you listen to the radio. When you listen to the radio, do you believe what you hear, or not sure, or take it with a grain of salt?
I would go from not sure to thinking you might be a quack.
Okay, so not sure to quack. So when you came here, you were very skeptical, right?
I was somewhat skeptical, less skeptical because I talked to my friend.
Okay, so your friend let you know. Did your friend have a good experience here?
Yes,
Did your friend have any bad things to say about this place?
no,
Okay, so you came very skeptical, right? Very skeptical.
yeah.
And so what changed your mind from skepticism to willing to try the treatment?
Well, the fact that the radiation was low dose. I mean, I would never consider going to a radiologist, for instance, even if I had cancer. That would be the last thing I would do. Or even to an oncologist, because I wouldn't do chemotherapy. Surgery I might consider if I had cancer, but neither of the other two.
Okay, but for the hip, it's actually just the opposite. You'd rather have the radiation at low dose than any surgery.
Well, sure.
Because you said you'd rather be crawling on all fours than to have
Well,
surgery.
That's correct.
Okay, and then you came here and we talked about all the options, and you chose to be treated, right?
Yes.
And you had 6 treatments, low dose to the hip. And how'd that go?
Well, it was over a 3-week period, 2 treatments per week, and after the first treatment, I didn't notice anything. After the second treatment was a little bit better, and after the 6 treatments, I would say it was about 90% better.
Okay, so you got dramatically better,
Yes.
right? And during that time, were you treated okay here?
Oh, sure.
Did anyone do anything to betray your trust or to make you question your decision?
And not at all, no.
Okay, was everything that I told you true?
Yes. No problem with anything you told me.
Did you have any regrets about anything I told you?
Nope.
Okay, so you're very special in that you were about 90% better, and then what did you decide to do?
Well, I waited a couple of months and I went for another series of 6 treatments. And the improvement there was not dramatic at all. It was mild, but noticeable and appreciated. If you want numbers, I would say I went from being 90% better to about 92% better.
So it's pretty good news, actually.
Yes.
And nowadays, by the way, when you had the second course, we spoke about some people wanting a higher dose of radiation to try to get more success. So we often offer that. Some people want that. Some people are happy with the 90%.
Yeah, we spoke about that.
All right. So any regrets about anything that you did?
No, not at all.
Any side effects of any type at any time during the course of treatment or after the treatment?
Very mild. I would say after each treatment, the next day, I would feel a little tired. That was it. Just that day.
Do you think it was because of the trip in or because of
the treatment?
You think because of treatment?
Yes.
And how long did that take to go away?
Maybe for about 5 hours during the following day, and then it was gone that day. So
Okay.
it would be a short period of time, but I noticed it each time.
Was it devastating
No.
or mild?
Mild.
Mild. Okay, so what advice would you tell someone who has arthritis?
I certainly say this is worth a try. You don't have much to lose, and it certainly benefited me, so there's a good chance you have something to gain.
And what questions would you have for me as a previously treated patients? What questions do you have for me about this process or the program or why we're able to offer it? Any questions like that? Or
one question I have is what actually happens? Is the radiation burning off the inflammation? I don't understand what actually happens.
well, there's inflammatory cells in a joint. So there's, the reason you have pain and stiffness is there's inflammation. Arthritis, when you have something with ITIS, it's an itis, it's an inflammation. And so there's an inflammation. White blood cells are in the joint and they cause pain, they cause suffering, they cause limitations of motion. And that's what we're able to attack, those inflammatory cells.
That makes sense.
What other questions could you think of?
None really.
For other people who have arthritis, would you tell them to go to physical therapy or medicines or surgery? Or what kind of advice would you tell them? You're kind of an expert having gone through this to some degree.
Well, I never went for physical therapy, but I did a lot of stuff on YouTube, like that recommended stretching, that recommended, can't think of the word, acupressure. And that helped a little bit. And I did that for about 6-7 years.
And how much did it help?
If I was at 30%, maybe it got me to 35%.
So it's very little compared to, 6 years to get to 35% versus six little treatments to 90% is a big difference.
Absolutely.
All right, well, thank you very much for coming. I know you came on your own time. And we, of course, didn't pay you to say this, right? You came on your own.
On my own, absolutely.
And you came on your own to try to help other people understand.
That's the only reason I'm here.
Okay, well, we appreciate that. God bless you. We hope you live to be 120 years old, and we hope you never have another pain the rest of your life.
Well, I expect to live over 120, but thank you, Dr. Lederman.
Well, we'll talk about your secret of longevity next time. All right, thank you so much.
Thank you, Dr. Lederman.
Okay, God bless you.
Thank you.